Hi everyone, it's Lisa Moeller with MedMark Media and welcome to another edition of Doc Talk Dental. We are very excited today to be chatting with Dr. John Julian. Dr. Julian received his Doctor of Dental Science degree from the University of Missouri at Kansas City Dental School in 1978 after doing his undergraduate work at the University of Kansas. He lectures extensively throughout the United States and Europe on dental implants and the use of lasers and new technology in dentistry. He has been called a visionary in the implementation of technology into the general dentistry practice settings such as digital scanning, cone beam, and platelet-rich fibrin procedures. Dr. Julian has mentored many doctors down the path of growing their practice through improving communication skills and the addition of technology and new procedures. I have a feeling we're going to be learning a lot from him today. His practice is named the Dental Retreat, and he's visiting us all the way from Travelers Rest, South Carolina. Welcome, Dr. Julian.
Thank you, Lisa.
So nice to have you with us today.
I appreciate that.
Okay, Travelers Rest, South Carolina, the Dental Retreat. All sounds very, very zen. I love it.
It's supposed to be an invitation rather than just another dental practice.
Right, exactly. It sounds like I want to come to the dentist. I want to have this experience.
Well, that's the way we hope it makes people feel, and we hope they leave with the same experience.
Exactly. Well, welcome to beautiful Arizona.
Thank you. Thank you. It's glad to be here.
Nice time of the year with the weather.
Wonderful. I enjoy the weather here.
So tell us about why you got into dentistry in the first place and specifically interested in the implant world.
Oh, it's interesting that I didn't have a burning desire to be a dentist. It seemed like it fit my skill set and education at the time. But I didn't know much about dentistry, and I was the first member of my family to go into dentistry. But as I've been in dentistry and been practicing, I've been in the best position possible because I've developed a greater passion for it as the years have gone by. I enjoy it more today than I did 30 years ago. So I really find that dentistry has fulfilled me in a lot of ways and given me an opportunity to do things for others, to do things for my family, to have a lot of control over my life. So I really enjoy it.
So what would you say is your greatest tool within your practice that you could share with our audience?
Well, I think there's probably two things I would say. One is to have the proper technology, and right now the most influential piece of technology in my practice is my cone beam.
Right.
Secondly is the ability to communicate with patients. Not to just tell them what you clinically can do, but to find out what they are desiring, what's appropriate for them, and then to be able to get them to see the value in it. Communication's a big part of dentistry.
Of course. If you're not communicating with your patients, obviously the treatment plan's not going to go very well.
Or the patient will seek treatment elsewhere. He will get frustrated. He'll just try to go someplace else.
Right. So let's talk about cone beam and your CBCT of choice. You use the PreXion Excelsior machine, correct?
I just put that in my office in February. Prior to that, I had the previous PreXion device, and I find that the Excelsior is probably the best machine on the market today. It exceeds everything I've seen in my teaching and my exposure to other types of devices, and makes me feel very confident in what I'm doing.
How so? Can you share some technology that's helped you with certain cases?
Well, I believe that everyone should have a cone beam. In other words, every patient that walks into my practice gets a cone beam as a screening device, because the problem in diagnosis and treatment planning is we're either underdiagnosing or overdiagnosing, and the cone beam prevents both of those scenarios. We're very accurate and able to present to the patient exactly what we see.
Right.
Then the patient has an opportunity to understand it, and they get to choose the direction they want their treatment to go, rather than me trying to tell them what to do.
Right. So you're educating the patient along the way with these scans.
Exactly.
Yeah, so important. I don't know who is practicing these days without a CBCT.
Well, actually, there's a minority of dentists that still own one and are using one, and so the idea is to get this education out there so more dentists will see the value in it and they'll incorporate it into their practices. That's our goal in education.
Right. Now, are there is there a difference in the software from one manufacturer to another that you're using with the CBCT from PreXion, or?
Yes,
okay.
and let me say this, that when I started my cone beam journey 10 years ago, I was searching and I was comparing manufacturers. One gentleman said something that really hit home with me. He said, "Doctor, I don't care whose machine you buy. If you're doing three-dimensional imaging, you're much better off than living in a two-dimensional world." And at that point, I started looking at it from the standpoint of how necessary it would be to see everybody in this light. The software, the ease of manipulating an image and understanding what you're looking at means the dentist will do more with it and do it faster, and he'll get more comfortable quicker. I know a number of dentists right now who own a cone beam but don't utilize it because it's a little complex for them, or they just have never gotten comfortable with it. And
Right.
typically it's in the software that they're not getting comfortable.
Exactly. Also the cost associated, right? I mean, some of the doctors get scared off with the cost. Speak to that part of it and
Well,
why you think that it's an effective purchase.
Cost is always an issue with everything we do. We tend to look at a cone beam and say, if I spend X dollars for the cone beam and I collect X dollars, a certain percentage of that back for taking a scan, then it will pay for itself and I can measure that. That is not the case with a cone beam. If I take a cone beam and I'm very accurately diagnosing, I will be doing more dentistry because I see more. Patients will be accepting more dentistry because they see more as well, and therefore the value of the machine far outweighs the cost per scan. Let me give you a story. My son graduated in 2010, started an office in 2011, and when he bought the office, he came to me and we had a discussion about what we should do with this existing general dentist practice that he took over. They didn't do implants and they didn't have cone beams. They didn't have a lot of technology in the practice. And I told him, I said, "Do you want to get out of debt?" And he said, "Dad, that's the whole goal, is to get out of debt."
Yeah.
And I said, "Then you have to put a cone beam into that practice. Hopefully you'll be doing implants and you'll be doing some other things, but the cone beam is the key to getting out of debt." And he looked at me and he says, "Wait a minute, how can spending more money, and a significant amount, get me out of debt?" I said, "Blake, let's test it for a year, get the cone beam, let's see how you do, and we will evaluate in a year." And a year later, he had doubled the production in the practice without taking on any new patients.
Wow,
So
that's huge.
he understands that just the accuracy allows him to see the dentistry that he was missing before.
Right.
So is it cost effective? Extremely cost effective. My personal story is I changed practices again 2011. I moved to Greenville, South Carolina from my home in Kansas. Started a practice from scratch with no new patients. My first day in the office, I don't know if we saw a single patient or not. We built that practice and we had maybe 400 patients by the end of the first year, which is not a strong number at all. And yet we performed enough procedures to pay all of our costs because we had a cone beam from the very first day. So whether it's a scratch practice, an existing practice, you must be able to diagnose correctly in order to do the amount of dentistry it takes to make any practice successful.
Right.
Now, also, let's talk about the idea of charging for the cone beam images. I do a lot of second opinions or emergency visits where the patient isn't sure what they're going to do, and we take the cone beam at no charge. I need the information. Once I have the information, the rest of the process is about educating, diagnosis, treatment planning. If I put a barrier to the patient of a high fee for that cone beam image, then I'm going to lose that potential for me to see and present the appropriate treatment. So we make the cone beam images as inexpensive as possible in order to be able to do the dentistry.
That's so smart, because really it's more for you to treat the patient more effectively and efficiently, and you can zero in on exactly what's happening.
Yes.
And the patient benefits in the outcome.
It's always about the patient
Yes.
benefit. If you're doing something, if you're doing the right thing for the patient, it's always the right thing to do.
Everything else will follow, right?
That's right.
So with PreXion CBCT, I know you've used theirs for a while.
Yes.
And so tell me, what is it about that machine that you just can't live without in your practice? I mean, can you pinpoint anything specifically?
When I first started evaluating cone beam technology, I would walk the floor at the American Dental Association meeting or the Chicago Midwinter, or some of the larger meetings. and I would just sit back and look at the image quality. PreXion always had as good or better an image quality as anybody else. That struck me, so I went and learned that there are many factors: focal distance, spot size, frame rate, number of slices. There's a lot of technical issues, and what struck me is that PreXion was always ranking in the top in all of the groups, where a lot of the machines were in the top in one or two group, but then they fell short in others. So the combination of their technology allowed them to have the best image quality. Then when I would go and manipulate the images, it was not even close. The PreXion image is intuitive. The software allows you to get to what you're trying to focus on quickly, easily. There's very few barriers in the way, and I can take anybody and train them in how to use their software in a matter of minutes. Mm-hmm. It just takes time to get used to reading images three-dimensionally, but you must be able to focus in and understand that image very quickly if you're going to do a diagnosis. Today, I can take a new patient, take a cone beam, and within 30 seconds to a minute have screened their entire mouth and understand if there's anything that we need to discuss.
Right.
That's really valuable because it's not consuming a lot of my time. Mm-hmm. So because I teach, I have a lot of dentists who come to me with their images, or I've been in offices where we tested other machines, and PreXion continually impresses all the doctors, and I keep kind of in a self-satisfied way looking at their images or them trying to manipulate their software and knowing that my machine is actually a cut above. And so I really appreciate the machine, and I got very lucky to choose them as my first company, and have stayed with them now for 10 years.
Oh, that's awesome. Love to hear that. So tell us about the courses that you do teach, and how often do you do that, and what are the topics?
Implants is where I started. Mm-hmm. And so anything related to implant dentistry. But we've done a lot of courses just on the cone beam technology. I do courses on laser technology. Platelet-rich fibrin is very topical in surgery and implant dentistry, and we do a lot of courses on that. The newest thing we're doing is osteodensification. There's a particular burr out there called the VersaBurr that has really grabbed my attention, and I'm finding that demands a lot of attention in courses. I teach both in my office and at a location in Fort Washington, Pennsylvania, at a place called the Dental Future Center. Mm-hmm. This is one of those moments in my life, I've been there now for a year, where I feel that I'm being asked to truly educate and not sell. And that's one of the most comforting feelings for me, because doctors come, we don't sell them products, we talk about use, we give hands-on use, we let them compare products, and it's been one of the greatest experiences of my life right up to date, that I get to actually talk about the principles of surgery and the principles of implants and the newest technology, and not to be restricted by any sales pitch.
Right. Not be overly commercial with anything.
Exactly.
It's really, I mean, these days in our industry, it's really selling through education. I mean, it's what works for you in your practice. It's what, the technology that's out there. And I mean, me having an implant publication, you can imagine I see all of the technology at all of the trade shows, and it's all amazing. And it, continues to blow my mind in the next 5 to 10 years coming up here, what the state of that is going to be. It's going to be huge.
It just keeps marching on.
Yeah.
And one of the things that we try to get dentists to see is they've got to invest in this. They can't graduate, set up shop, and then get comfortable.
Right. We've got to keep evolving and changing for the patients. So tell us, what do you like to do in your free time? What do you, besides when you're not teaching courses and placing implants, what do you like to do?
My wife will tell you that dentistry is my first passion, because I'm either practicing, preparing for a lecture, giving a lecture, or in some fashion working on an article or something like that. Mm-hmm. But I also enjoy, my family is very important to me. I have 6 children.
Wow. And
keeping in touch with 6 children.
That's a lot.
Trying to keep things in a family going forward is really hard. I'm sure not all my children understand that sometimes when I'm being a parent, it's for their benefit, even though they don't like it at the moment. And yet, as parents, we've all been through that. Yep. I like health. and I work hard on keeping my health up. I exercise regularly. I take my dogs for a walk in the mountains. My children and I get together. We're very active. We do things. And so whether it's a sport or anything like that, I just try to be active and stay fit. I worry about my diet. I worry about, how I take things in as well as how I keep my body going and keep moving.
Mm-hmm. That's good.
So my passions, I used to be a sports fan in a lot of ways. That's waned, except I went to the University of Kansas, and I'm really a college basketball fan, and my Kansas Jayhawks probably get more of my attention than any other sport.
Oh yeah,
I
that's
do.
big. That's
Yes.
big, right? Nice. So, in closing, what could you share with our audience 3 best practices that have, if you can think back, that have just along your career that have made you the success that you are today? What could you share with our other doctors regarding that?
I think that the one thing that stands out in my mind is I'm never satisfied, and I never feel like I know it all. Always have something to learn, and I always can practice to get better. Secondly, I didn't like doing surgery when I first started in practice. Now I'm doing surgery every day. I enjoy it. So not closing my mind because I feel a certain way today. I always want to keep an open mind. Finally, whatever I'm doing today, there's somebody out there that's doing it in a way I would like to do. I always can learn from somebody else. And interacting with other doctors has been a real strength of mine, that I never feel like I'm the expert in the room. I'm always the student in the room trying to learn. Mm-hmm. And so whether I'm giving a course or whether I'm attending a course, I just enjoy the interaction with the doctors. And I've made a lot of really close friends and good friends in the dental field. That's nice. That's a very warm feeling.
Yeah, that's nice. There's a lot of amazing talent out there. I'm sure you guys are all learning from each other.
Yes.
Every day. Well, thank you so much. This was super informative, and I know our audience is just going to love it. Will you come back and chat with us again when you're in town?
Lisa, I would love to. I've spent some time with you now, and I really have enjoyed the time. I think you're an easy person to talk to, and you're sincerely interested in dentistry, which makes me feel very
I really am. And also, if you could write some more articles for Implant Practice, we would love that as well.
I will see what I can do.
You're welcome every time.
Thank you very much.
All right, thanks so much. Take care. So that's going to do it for another edition of Doc Talk Dental. A special thank you to Dr. John Julian for sharing his time and knowledge with us. For more information on Dr. Julian's practice, please go to thedentalretreat.com. We'd also like to thank PreXion for sponsoring this important episode. For more information on their amazing imaging products, please go to PreXion.com. As always, for more info on everything implant related, check out our publication at implantpracticeus.com. We hope you've enjoyed your time with us today, and we look forward to seeing you again soon. Take care, everyone.